I'm filling in for Steve Triffletti just for a few minutes today while he's buzzing back from court. And we're welcoming you to our COVID-19 update for the town of Plymouth. Every Wednesday, Steve will be here at noon with a great set of panelists. This forum is being brought to you by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email them in to plymouthinfo@pactv.org. These forums will also be able to be replayed at pactv.org/Plymouth. Today's participants will include, as always, Ken Tavares, the chair of the Plymouth Board of Selectmen, Phil Triffletti, M.D., attending physician at BID, Dr. Barry Potvin, who's the professor emeritus, at in the Department of Biology and the chair of the Plymouth Board of Health, Gary Maestas, who was the former superintendent of schools here in Plymouth, Michael Jackman, who's a district director in the Congress, and Heather Cozby, a local CPA, and of course Matt Muratore, our state representative. We're going to start, as always, with a town opening statement from Ken Tavares. Welcome, Ken.
Hi, thank you, Julie. You're doing a good job. I want to bring a couple of subjects up today, and the first is that I'm going to hold it up. It's show and tell. Is the voter red pamphlet that was sent out by the Secretary of State's office last week. Many of the households in the Commonwealth have already received this. This packet has all of the information that you need for the next voting season, which is starting right now. There's all sorts of great information, and we must remind everyone that there are 2 questions on the ballot, and there's a great deal of detail in this printout that the secretary sent out. If you did not get one, the town clerk is going to have one at the entrance to town hall. She'll be able to distribute these. So all you have to do is go to the entrance to the town hall, or if that isn't convenient, call the Secretary of State's office for further information, and they will send one out to you. The next subject is a little bit more sensitive, and I know that Dr. Potvin is going to be talking in detail. Those of us that are looking at the figures on a daily basis are becoming concerned that our numbers are going up, and the time to start planning and deciding what we're going to do is now, not when we're in the middle of it. So next week, there are a couple of meetings that have been scheduled for us to begin to look at these figures in depth and decide what actions we can take, just in case they start to go up. This is going to be extremely important, which leads to what we talk about at every one of these programs, and that is, you must wear a mask. It's extremely important that be done, no matter what others might be saying. Also, keeping distance is extremely important, and now, of course, washing hands is just as important. The emphasis has to be on these 3 areas. Every expert tells us that these are the things to do. We have a lot more activity going on. Today, our schools opened, and it was great to see the buses running and the children getting back to school. But there are more opportunities to spread this virus, and this is something that we need to collectively work on as a community to prevent these numbers from escalating to an unacceptable level. Thank you, Julie. I'll pass this on now. Thank you.
Thank you very much, Ken. And I'd like to now turn over my end of this to Matt Muratore, who's going to act as the moderator of today's forum until we get Steve Triffletti back on set here. So Matt, go ahead and introduce our next guest.
Great, thank you so much, Julie, appreciate that. And Ken, I just want to add to what Ken just said too with regard to the schools. As a father of 3 school-age kids, I'm so happy the schools are open, Gary. Thank you for what you and your team have really put together here in Plymouth. It is important, I think, that the children do get back to some education and socialization. And I tweeted out something this morning about the teachers and the staff. You're real heroes now for what you're doing. So as a parent, we really thank you for that. I also just wanted to, Ken and I yesterday were at the Council on Aging yesterday, the Center for Active Living. Just a shout out to some of the seniors that went through the parade there. There was a drive-through parade there, and a number of seniors came through, and a number of seniors talked about how they watched this show and look forward to the show every Wednesday now. Watched every episode prior to this. So it's really good information we are getting out to people. So a shout out to those folks. Actually, one woman indicated that she doesn't do yoga on Wednesdays virtually at the Cal because the show is on at 12 and interferes with it. So we are getting good information out, and I thank all the guests who are here today. So right now I want to turn it over to Dr. Phil Triffletti, attending at Beth Israel Deaconess. Welcome, Dr. Phil.
Thank you very much, Matt. My pleasure to be here again. It was very nice introduction there by Ken, talking about watching the numbers carefully and all the things we need to do to really contain this pandemic in our local communities in terms of wearing masks and hand sanitizing, social distancing. I'm going to go into some of those things in a little more detail in my talk today because I'm very fascinated and interested to know how well does some of these things work. I had the pleasure this past week, being at a Harvard teaching hospital. Once a week, we usually have a lecture called Grand Rounds, and our season runs from basically September through May. So we usually have a special invited guest to open up the season, so to speak. And so it was virtually done, but our guest speaker was actually Dr. Anthony Fauci. And that was really wonderful to have him give us a lecture here in Boston and really update us on all the things related to COVID-19. So some of what I'm going to talk to you about today is a lot of the things that he talked about. Nothing that's probably really that much new, but I think it's all worth reinforcing because he is such a great expert and such a real national treasure for us right now in terms of leading our efforts against the pandemic. So the first thing, he did talk about, how do we catch the virus, of course, and we believe it's mostly really a respiratory virus. We don't know how much virus transmission really comes off of contact with surfaces, but it sort of brings us back to this whole thing about wearing masks. And I've been looking for data, how effective are masks? And I did find a study, preparing for today's broadcast, a study that was published in June, McMaster University up in Ontario. And in that study, they actually showed statistically that masks, they used numbers like, reduce the risk of infection, say for people out in the community, maybe reduce the risk of infection, maybe 85%. So if you were close to somebody, in close contact with somebody who was infected, if you were within 3 feet of them, you might have, in this study they did, maybe a 17% risk of getting infected from them if you weren't wearing a mask and you were within 3 feet. If you were wearing a mask, the risk of infection dropped from 17% down to about 3%. And so that translates into roughly 85% risk reduction. So that's a huge difference, and part of the reason that we're emphasizing masks so much. And then they also quoted some data from the healthcare workers and showed that in that case, when healthcare workers are using the N95 masks, those particular masks, probably are about 96% effective. And so if you think of a risk that might be roughly 15 to 20% and you reduce that by 96%, that's a huge reduction in risk. So anyways, lots of votes for masks. Continue. One of the things that I did note that I don't think has been publicized much, but I have heard it mentioned in the media, and you may want to think about this, is that the masks that have valves on them, the valves are there to make breathing easier on you, when you're exhaling out of the mask. And, of course, these masks, some of them are designed for industrial use. And so in an industrial situation, it might be fine to be exhaling. But when we're trying to do it as an infection control procedure, wearing a mask that has a valve on it is probably actually possibly counterproductive, because you might, if you're infected, you could be breathing out a virus, with the air. So So that would be a vote against using a mask that has a valve. And I think also always just remember, you have to wear the mask properly, over your nose and over your mouth. Has to cover both. One of the other striking things that I thought he brought up was that I think early on in the pandemic, there wasn't much concern about the issue of whether we were having airborne transmission or not. And they were thinking more that the transmission through the air was through large respiratory droplets. But I think Dr. Fauci is more convinced from talking with a lot of physicists that in fact there is an element of airborne transmission. And why is this so important? Well, I think it comes back to why we want to try to avoid indoor closed spaces. And so he cited, some of the areas we know where there's been terrible outbreaks of transmission, things like cruise ships, prisons, nursing homes. There have been many examples of where there's been a lot of transmission of the virus in these types of settings. And so I think, and that's because we believe that virus probably gets out in the air and floats around. So I think that in decisions that we're making, whether it's in the community or you're making it your individual personal decisions to protect yourself, I think you want to still consider, only going into indoor spaces when it's more essential and trying to, limit that as much as possible. I do think outdoor is probably safer. I found one study about restaurants, and unfortunately, they didn't discriminate between indoor dining and outdoor dining, but it did seem that restaurant use was associated with an increased risk of transmission. But I suspect that it's really more in the indoor environment than in the outdoor environment. Another factor he pointed out I thought was very interesting was that they did some studies of our mobility, how much we were moving around the community during the outbreak early in the spring, March, April, May. And it turned out in the United States, it felt to me like we were staying indoors every day and we weren't moving out of the house. But they actually compared our statistics with those in Europe, and they looked at grocery store and pharmacy use. And in the United States, we probably had about a 20% reduction in those activities, but in Europe, it was more like 80%. And then he showed the curves of what happened with our infection and how much our infection dipped and how much Europe's infections dipped. And they had a much bigger drop. And so, there does seem to be clearly an association between what our behaviors are in terms of mobility, as well as all the other mitigation strategies that we do, and how many infections are transmitted in the community. And so, we didn't really have nearly as much of a shutdown as they had in Europe. But it does appear that when you do shut down more, you have less transmission. I mean, that's sort of things to think about, as we move forward, if we run into more problems in the community with, rising rates. Another issue that he raised, I think, is worth emphasizing again, that they believe about 45% or so of all infections are transmitted from people who are asymptomatic. And so that makes, all of this fighting the pandemic so much more difficult. We can't rely just on symptoms. We can't rely on temperature screening. That's why wearing masks is so important, because we don't know, who might be infected if almost half the people who are infected aren't feeling it and could transmit the virus. So again, that's another vote for masks. I think it's another vote for, limiting social gatherings to, as small sizes as possible. And, I think we've done a great job in this state encouraging that. Obviously, we see some issues occurring in the colleges and high schools with parties, et cetera. Occasionally with weddings, that people don't, respect the recommendations in terms of, limiting to a size of 50 outdoors. I think we want to continue to do all these things going forward, until we get a vaccine. He's very optimistic about having a vaccine, possibly by the end of this calendar year or next spring. So I think he's been steadfast on that, and that's very exciting, because I do think that that's going to be probably the biggest thing we can do to really stop the pandemic, is get an effective vaccine. Hopefully people will take it. It surprises me, how many people might either not trust vaccines or be afraid of it. But I do think vaccines, once they get approved, they will be safe, they will be effective, and I think we can be confident that it's the right thing to do. And then the last thing, I saw an interesting show on CNN. I love watching Fareed Zakaria, is one of my favorite, TV journalists, and he did a little short piece on Taiwan. I thought it was fascinating. They've only had 10 deaths in Taiwan from COVID-19. They have 26 million people. So that's roughly about, I think, the size of the state of New York. And they've, of course, New York's had thousands of deaths. So it's amazing how they've controlled the pandemic. And some of the ways that they did this, very interesting. Of course, they have a much stronger public health system. They do a lot better job of contact tracing. They got out in front of the pandemic early, so it makes it easier when you have fewer people that are infected. It requires less resources to do the contact tracing. But one of the things I thought that was most interesting that they did differently in their country was that when you got infected, you didn't quarantine at home. You had to go somewhere. You had to go to a hotel or facility, and they required you to quarantine there, so that the state, so to speak, really controlled the quarantine. And so it's just interesting how different countries, have faced the pandemic. Obviously, different states do it differently here in the United States, but it does seem like there are things we could learn from others on how to do a better job. So that's all I have to start. I look forward to questions later in the final comments, but thanks again for having me.
Thank you. That's Dr. Philip Triffletti. He is a primary care attending physician at Beth Israel Deaconess. You can send your questions to PlymouthInfo@pactv.org. And at this time, we once again welcome Dr. Barry Potvin. Barry is the chair of the Plymouth Board of Health. Good afternoon, Barry.
Yes, hi. Thanks for having me again. Also, welcome back from the court. I hope it went well. So what I want to do today was I'm going to be probably emphasizing an awful lot of stuff about public gatherings, both in public spaces and in private areas. This seems to be the major contributor to the numbers that we're seeing, which are going up at the moment. To put that in perspective, I want to give you some data. So if you look at the 7-day average of daily average of positive cases as a percent of total cases, in the United States at the moment, that's a 4.8. The two that are the worst states in this country, apparently at the moment, are South Dakota and Alabama at 16.6. So think about that. That's 16.6% of the tests that are being given are coming back positive. There's others, the ones you think about probably are Florida at 12.5, Texas at 8.3. And then you look at New England. Well, New England has done a lot better. Generally speaking, in New England, we're a little bit below 1 for most of the New England states. Massachusetts, as you probably know, is generally assessed at about 0.8 to 0.9%, depending upon how they do the calculations. Then if you look even more carefully at Plymouth County, that number comes up to be 3.7. So we're doing, a little bit better in general. Massachusetts in general at the moment is, I think, 4.6. So Plymouth County is definitely below the average for Massachusetts. Among the towns that surround Plymouth, where we're at 3.34, although I must caution you that changes every Wednesday. Today is Wednesday. So sometime later on this afternoon or early evening, you will see new numbers on the state map for counties and also for towns. It may be going up for Plymouth this past week. Around us, the ones that are higher than us are Middleborough at 4.52 and Carver at 4.11. Duxbury, for some reason, has gone up to 3.78. It's not around us, but I just saw an article about Nantucket where they're having a really large problem at the moment. They had 30 new cases of COVID in the past 5 days. That's very troubling, and their number has gone up to 4.22. So they are now in the yellow zone, which means moderate risk. If you go above 8 on those numbers, you go into the red zone, and then you can actually find yourself in a position where there's going to be state enforcement teams coming into your town to try to further enforce the rules and regulations and guidelines that's been put out by the state. So that's some of the numbers. The other number I thought was good to put into perspective is just deaths. So if people don't take COVID-19 seriously, you have to understand that there's been 194,092 deaths in this country so far caused by COVID-19 infections. Compare that to what happened in World War II. It's a little lower. World War II, there was 291,000 deaths of US citizens serving during World War II. Vietnam was about 49,000. The Korean War was 33,000. Even World War I was 53,000. So what we're looking at here is something that is really, really dangerous, causing an awful lot of mortality. And the only thing that comes above that level of mortality was World War II. You might also think about 9/11. We just had 9/11. When I was working still in the New York area, I had the unfortunate front row seat in my office, which overlooked the World Trade Center from up at 185th Street. And I could see what was happening. How many people died on 9/11? Well, it was about 2,996 people. That was a tragedy. It brought everyone together. There was no politicization about what was going on or how to do it. The entire country united. We fought really hard. We sent troops over to Afghanistan to try to stop it, and we succeeded for the most part. Now, here we are in Massachusetts currently with 9,016 deaths in the state and 123,425 confirmed cases. And what are we doing? Well, it depends upon your political leanings. And instead of uniting together, it's a bunch of different factions of people that have different opinions about whether or not this is a serious problem and what to do about it. So I don't know about the rest of the people in the town, but to me, that is an unmitigated tragedy. Everyone should be fighting together on this. And certainly the Board of Health is doing all that we can. We're trying very hard. We need a coordinated effort. So we need to cooperate and coordinate with the schools. We're doing that. Thanks very much to the school officials who've been working directly with the department and with the Board of Health. We need cooperation with the businesses. We've been doing that. We've had a lot of interaction with the businesses, especially through Amy Naples. And we need a lot of coordination of our efforts with the town officials, all the town officials. So we're talking about the select board, the town manager, everyone that you can think of that's involved with this. We need a lot of support. The Board of Health, the Department of Public Health can't succeed alone. Then we need an awful lot of cooperation and continued vigilance on the part of the citizens of Plymouth, and especially given that the school's open today, on the part of the parents. This is critical because if you read what happened today in school openings, Attleboro apparently has put 30 high school students in quarantine after one student showed up for class, apparently had a positive COVID-19 test, perhaps hadn't yet shown much in the way of symptoms, but he was in school and the school system didn't find out about it until a day later. So now there's 30 students in quarantine. Hopefully they won't be infected, but certainly they could be. If you also look at Plymouth Patch, which is a source of a lot of information, you find a lot of things going on which are very worrying. Dover-Sherburne Regional High School had a hybrid plan started Tuesday. They shifted to online only after 150 unmasked students were found at a party. Lincoln Sudbury Regional High School had the same situation. They had 50 or 60 students found without masks at a party. They also had to switch back to totally remote learning. Chatham has had a cluster, and it's the latest cluster in Massachusetts, traced back to a popular restaurant in Chatham where 7 employees at the restaurant all tested positive for COVID-19, but continued to be working in that restaurant. Dedham, they had a week before school was set to restart a series of parties that's blamed for a source of COVID-19 clusters that brought the town numbers up to the state designated red level. The school committee then voted to postpone in-person classes indefinitely. Monson, I'm not familiar with that town particularly, they found a private party leading to an outbreak of coronaviruses and making the small town the region's only high-risk community, again delayed the start of school. New Bedford, they had 2 isolated outbreaks, one in an independent storefront church and another at a nursing home, and they elevated New Bedford up to the red risk level. So there's an awful lot of this stuff going on, and it seems to be mostly concerning gatherings. And if you start to think about, well, what kind of gatherings do we have here in Plymouth? We've had complaints from people about gatherings at local parks and recreation areas where there were too many people present, and most of the people present were not wearing masks and maintaining social distance. That's an ongoing concern. It's difficult to actually enforce regulations about that, simply because when this happens, we get reports after the gathering has already ended. So what do you do? The only way to control this would be to know it's happening in real time and try to get local police to cooperate with the Department of Public Health and the Board of Health to actually get to that location and break up the gathering before it's too late, or to at least encourage them all to wear masks. So I don't want to go on too much longer about this. The problem with Maine is still going on. There were 65 guests, 83% of them had symptoms. One person came to that wedding who apparently was pre-symptomatic, resulted in 176 cases and 7 deaths. So this again is a problem with people just flouting reasonable regulations and guidelines, rebelling against them, and sometimes in a very aggressive manner, and causing an awful lot of problems for everyone else who's doing their best to try to control all this. I'll be happy to answer any questions anybody has. I don't want to take up too much time doing this because obviously there's a lot of speakers on the panel today. So thank you very much, Steve.
Thank you, Dr. Barry Potvin. He is a professor emeritus from Yeshiva University, the Department of Biology, and again, the chair of the Plymouth Board of Health. A great lead in to our next guest who's returning. A busy day, the first day of school. We welcome Dr. Gary Maestas. And Gary, Dr. Potvin kind of gave you a good lead in. I assume that you're well prepared and that you have a response if anything happens in the schools similar to what he reports in some of the other districts. Good afternoon.
Good afternoon, Steve, and thank you, Dr. Potvin. That's a great overview of conditions here in Plymouth and also what's happening around the Commonwealth and around the country. So yes, today is our first day of school here in Plymouth. It's a long day that we've been waiting for a few months, and just very excited. I went to 4 schools this morning and had the great opportunity to visit with our students and teachers, and it's just wonderful to see our students come back into school, the upbeat nature, the smiles that you can imagine on those masks, but it's just very upbeat. Our schools are extremely clean, the cleanest I've ever seen them. We have all our supplies ready to go. We have all the protocols and the arrows and the locations where to stand. We had morning breakfast, bag breakfast available for students to take into the classroom when they first got there. But our biggest concern is following through with protocol, and I think we have a great plan in place for our students to be able to attend schools under the guidance of our administration and teachers. The biggest thing that we can rely on, and we hope to rely on, is our kids coming prepared every day to be able to follow these protocols. One of the things that I have realized in my time dealing with COVID is, the first day of activities, everyone's excited to come back and they follow the rules, but every day that goes forward, they seem to get more and more lax, and we really can't afford that. So our support really comes from our families and our students that come to school every day to be able to exercise those policies and procedures that we put in place. feel very comfortable that we have a good plan. A lot of questions have been answered over the last 2 months with parents and the community over how we were going to reopen. But today I'm here to report that our schools are open, doing well. South High School this morning had a fire drill, not necessarily a fire drill, it was a fire alarm that got kicked off right away when the kids came in, and they got tested early. But it's great to see that our bus capacities are working. The traffic flow at our schools is not bad, keeping in mind that we have half the students in our schools actually attending school. It's actually less than half because some students are full remote. Now, let's talk a little bit about the information that Dr. Potvin shared regarding schools closing and schools shifting from hybrid to remote, full remote. The concern that we have is that we in the school system don't find out when a student has been exposed or tested positive. So that communication between home and school is vital. Our school, every school in Plymouth has a school nurse, and that communication between home and school is very crucial. So we have had a lot of questions and we've tested our protocols, but it is all going to fail if we don't have information. So the big message I have for parents today is if they know their child has been exposed to somebody that's positive, they need to call the school. If somebody at home has been tested positive, please do not send them to school. We do have protocols in place. And the biggest thing that I can share with our students, our families, our grandparents, anyone out there, that this large group gathering, we don't want to tell people they can't do that. We want to encourage people to enjoy themselves, but there are protocols for that as well. The mask mandate is there for a reason. And I think we had, 2 presenters so far talk about how important it is to follow through with those protocols. And our schools are functioning well on day 1. We want to make sure they're functioning well on day 2 and day 170. And that's what we have this year. We have 171 days of school because we curtailed our schedule to provide 9 professional development days for our staff to be able to be prepared for the opening of school today. So we will have 171 days of school. Today is day 1, and a great start to the school year. And I just want to express my thanks to Dr. Potvin and the Board of Health, the health department here in Plymouth for their guidance, and everyone else that has just been so encouraging to the school department to get our schools open. I'll tell you, our custodians and our staff deserve the greatest applause that I can probably ever give them in my 32 years of being an educator. Our schools are the cleanest I've ever seen them. Our teachers are excited and upbeat and ready to go. And going out on a 32-year career on COVID is not the thing that anyone would ever want, but I'll tell you what, they've made me proud just being part of what we've been able to do here in the last few months. So with that, Steve, I'll turn it back to you.
Thank you, Gary. That is Dr. Gary Maestas. He is the Superintendent of Plymouth Public Schools. Please send your questions to plymouthinfo@pactv.org. And at this time, we welcome back Michael Jackman. He is the District Director in Congressman Bill Keating's office. Welcome, Mike.
Thank you, Steve, and thank you to Julie and PAC-TV for hosting these forums again and restarting them. It's great to see a lot of familiar faces, and I've already got a lot of great information from the previous speakers. And I would be remiss if I didn't take the opportunity, since I'm speaking right after Dr. Maestas, to congratulate him on his upcoming retirement. And on behalf of the congressman in our office, just thank him for his vision, his enthusiasm, and his energy, and all that he's brought to the Plymouth schools, making them such an excellent school system. So thank you, and best wishes to Dr. Maestas. So it's been a while since I've been on here and on these forums, and there have been some developments in some of the benefit programs that folks have been relying on or had been relying on during the first few months of the pandemic. The House did vote in favor way back in May, so that was before the forums took a little break, on the HEROES Act, which would have extended the stimulus check and actually provided a higher amount for dependents, would have extended the pandemic unemployment assistance through the end of the year, and would have also, I believe, extended the payroll protection program. But unfortunately, the House passed, but the Senate did not. The negotiations are ongoing between the House and the Senate and the administration to come up with some sort of legislative relief package that will help out folks who are still out of work, unable to, keep deal with food insecurity, housing insecurity, all kinds of issues folks are having because of the pandemic. The Speaker of the House has said that she will keep the House in session until a package is finalized. So that would be an unusual step, and I think it's a glimmer of hope that there will be some sort of agreement in the next coming weeks or months. In the absence of a legislative relief package, the president did issue an executive order at the beginning of August, and we have seen that kind of been fleshed out over the last few weeks. The executive order had four main components. The biggest one I think people have heard about and have actually seen benefits from is the additional $300 a week for unemployment beneficiaries. That was funds that were diverted from FEMA disaster assistance. So we're hoping against reality that these upcoming hurricanes and the fires out in California are still going to be able to be adequate resources to deal with them. But the funding is for the unemployment. They call it the lost wages assistance. It's $300 a week. And the Commonwealth of Massachusetts did apply for those and was accepted for 6 weeks starting in August and extending through the first week in September. So folks who were eligible and certified to receive unemployment benefits, whether it's traditional unemployment or the pandemic unemployment, which is generally speaking for gig workers and self-employed workers, they will be receiving, or probably already have received, that extra $300 a week for those 6 weeks. The other three items I'll go through real quickly. The student loan deferments, interest was waived until December 31st. That's on federal loans only, not private loans. And it doesn't mean you don't owe money. Oh, you don't owe back those student loan payments for the months that you don't have to pay, or you don't have to pay interest, but it's deferred till January 1st of 2021. Payroll tax deferment, which I think Heather might be addressing in her portion, so I won't get into it too much. It is voluntary. It's only for employees who earn less than $100,000 a year, similar to the stimulus program that was implemented by the CARES Act. And again, those taxes that are deferred for the period from September to December, you still owe those taxes. So if you're an employee and your employer has volunteered to take part in this tax deferment program, you are going to owe those taxes in January. So that's really important to remember. The last item is the eviction moratorium. The CDC did implement a program after the president made the executive order. And folks who have suffered a job loss or a loss of household income due to COVID can make a declaration. It's a CDC form that you can download or get on their website. And they can present that declaration to their employer, to their landlord, to say that they're unable to pay their rent because of COVID. Now, it doesn't mean you can't be evicted. You can be evicted for other reasons, as long as it's not to do with non-payment of rent. So those are the four items that were in the order that affect most people. Of course, in the state, we have our own eviction moratorium, which has been the subject of some legal challenges. And even this federal moratorium, some judges in different states are taking a different view on it. So it's a lot of questions, and I would certainly refer folks to housing agencies like South Shore Housing, NeighborWorks, in order to get information about their particular situation. The last thing I would want to mention, because the deadline is coming up so soon, the census, which you heard about me turn blue in the face talking about back in the spring. Well, we finally are coming up to the deadline. The deadline, the Trump administration in its infinite wisdom moved up the deadline from October 31st to September 30th. And if you have not replied to the census, you really need to do that now. Go to 2020census.gov and find out how you can respond to the census. And we're still getting calls in our office from folks who either have not got census materials, or if they got it, they inadvertently discarded it. So please take the time to make sure you filled out the census. It's so important because towns like Plymouth and Massachusetts, all over Massachusetts, rely on that census data to figure out how formula funding from the federal government is going to be calculated. And if Plymouth is undercounted or Southeast Mass is undercounted, then that could have implications for federal funding for the next 10 years. So I can't emphasize enough how important the census is. And if anyone has any questions about the census or any of these programs, as always, they can call our office at 508-746-9000. Thank you, Steve.
Thank you, Michael Jackman. He is District Director for Congressman Bill Keating's office, and he's now being followed, as he was in the past, with our Plymouth CPA, Heather Cozby. Welcome, Heather.
Hello, Steve. Hello, everyone. So good to see everybody again. I feel like it's been forever. And honestly, doing the show weekly was better for me because it kept me more up to date. I was a little more diligent, but there's so much I could talk about. I'm going to try to just hit on a few things that will hopefully help anybody who's watching. So I'm going to start with just a few items that our office has been getting a lot of questions on regarding individual taxes. So many people who mailed in their tax returns were done. They mailed in their payments to the IRS. They're starting to get notices from the IRS saying that they didn't pay their taxes. And the IRS hasn't finished cashing checks from like 3-4 months ago. So the IRS acknowledged this, and I'm just want, if you've got one of these notices and you're worried about it, don't worry about it. If you mailed in your payment, give the IRS another month or so to continue to cash these checks that were sent, and ignore that notice. You'll want to go and look in your banking records to make sure that your payments to the IRS did in fact get cashed. So as long as you have proof of it being cashed, you can ignore that notice. The second side of that is the IRS has been issuing small interest payments. So they've been issuing small checks to taxpayers and also small direct deposits into their accounts. And what nobody knows what they are. What they are is their interest on your refunds. So because of the timing of everything, if you filed your return on time and the IRS didn't, they didn't issue the check, honestly, it's 2 pages long to explain it. At the end of the day, if you get a small check for $17, $18, keep it and cash it. It's interest, it's yours. You'll unfortunately get a 1099 at the end of the year that it's income. You got to pick it up. But just know that if you see these random things, it's okay. You're fine. Cash the money. Go out to a restaurant, buy dinner. The other thing that's been going on is a small thing. If you are a taxpayer that has a trust and you have a trust that files its own tax return, or what's called a Form 1041, this year the due date got moved to September 30th. They've normally been due October 15th. So I just wanted to, again, mention this as a random change that's happened. I needed to, re-go through all of my clients to make sure that we get those filed on time. But a Form 1041 is going to be due September 30th, so 2 weeks from now. Michael, I'm so happy that you went through all of the presidential order. So basically, I just wanted to point out that yes, there's no round of stimulus there that's come out. A new package is expected to come out. There's been lots of speculation about what's going to be in that package, from the PPP items to other items. So that should be coming out. I'm guessing I might be invited back in the next couple of weeks to go over that when that comes out, but just sit tight, it will come out. So on the personal side, the only other thing is if you've been giving to charity this year, only because under the CARES Act, this was allowed, keep track of your charity. So most people are like, I don't have to keep track of charity or itemized deductions because I'm taking the new standard deduction. There is this small additional deduction you're going to be allowed, even if you take the standard deduction this year. So just keep those donations you've been making to help out others, keep them aside, make sure you use them for your records next year. I think it's $300 a return you can deduct on the first part of your tax return, even if you take the standard deduction. So that's just a small thing to remind you of as well. So moving over to the business side, I want to start with my favorite topic, which is the bill that isn't passed yet regarding expenses and PPP money. So those who have seen me before, there's an issue with the PPP loans and the IRS saying that you can't deduct the expenses you paid with that money. Basically, this has been in the Senate and the House have matching bills, and it hasn't been passed yet. I'm hoping it's a part of this legislation that comes through. I know it's still having positive movement because there were, I think, there were 8 co-sponsors added in the last week between the House and the Senate. So what that means is it's still in discussion. There's still need to get this done. It is so vital for businesses to understand if the expenses they paid, their payroll money that they spent with their PPP money is deductible or not, because that is going to have a huge tax impact on them. My gut, my crystal ball is telling me they will sort this out. It just hasn't been a top priority. It's been in committee or sent to committee since May, but hopefully as a part of this process, they'll remember to add this in and get this done before the end of the year. Because businesses who got $100,000 in PPP money, they don't know if $100,000 of expenses are deductible. You think about what that means for them for tax planning, it's incredibly stressful and everybody's very worried. They don't know what to do. So that's an update on that item. I wanted to also bring up, before we get to PPP, because I'm saving the best for last. So the net operating losses. So the CARES Act allowed businesses to carry back net operating losses. So if you have a year where you have a loss, you weren't able to carry it back under the old law. Now you're able to carry back losses incurred in 2018, 2019, and 2020. What that allows you to do as a business is go back, put those losses on a previous tax return, and get tax money refunded to you. So this is something this fall that if you're a business and you had losses in 2018 and 2019, you need to look at those tax returns and start the process now of amending those returns before you get into the next tax season, because if you have to use an accountant to do those returns, you're not going to be able to get into those accountants during the spring. That's just the reality. And then if you end up with a 20 tax loss, you can do that amendment next year. So I wanted to remind that in case businesses they're going to start looking for any resource, anywhere they can find money, and getting some of those losses and that tax money back to you is a great way to get pretty quick money. And I think you'll get some interest on that as well. So regarding the payroll deferral program that Michael talked about, I just want to point out that there's a lot of information that's coming out and there's still a lot of questions about how this is going to work. And although it is optional for employees to opt in to do it, I want to point out that, in fact, if you work for Department of Defense or if you're a government employee, the federal government has said you cannot opt out of it. So they're forcing all, if you're in the military, you're going to have this deferment automatically done. So it is optional, and in most private industries, it might be easier for it to be optional, but I do know that all our military families are going to be affected and they don't have a way to opt out of this. Obviously, it's just a deferment. You're going to have to pay this. I mean, if it's the employer making the decision, I would tell every employer not to do it, only because it just pushes the can down the road of something they have to pay. If you're an employer and you defer taxes, they're called trustee taxes when you're dealing with employee taxes, you are personally liable for that. That is a type of tax you can't get out of under any circumstance. So be very cautious with the type of taxes you're deferring and know that you can pay them in when they're required to be paid, so you don't create more problems for you down the road. And it's not something that you can make go away in bankruptcy. So that was just a really important point I wanted to give. And then on to PPP. So the loan program's over. Those have all, as of right now, you can't get a loan. So everybody's moved into the forgiveness process. And the forgiveness application is available online through sba.gov. This is what my recommendations have been with my clients. Number one, I think there's a possibility that there could be an additional change to the forgiveness process in this law. There's been a lot of talk about whether they'll pass a law that says if your loan is under $100,000, it's just automatically forgiven. So I tell my clients who have loans under 100,000, let's just wait a little bit longer. Let's see what happens with the next law, and then, you know, deal with the process of applying for forgiveness. The second step is, just like when you obtained your loan, you had to go through the bank. Every bank is also going to process your forgiveness application. So wherever your loan is through, the bank has the SBA information, but then the bank is going to have their own process to work with you to submit the forgiveness application to them. So it's not something that you can go, hey, accountant, can you get this done for me? Because every bank's different. And this information is simple. So you need to actually reach out to your bank. A lot of banks are having webinars for their clients to tell them how they're going to do the forgiveness application process. You need to work with your banker to find out what their process is. You're going to end up submitting your package to your bank. Your bank is going to basically vet it out, and then the bank is going to submit it to SBA for approval. Once SBA approves the forgiveness, then at that point, the loan is forgiven. So again, there's a lot of information I think that might change in the next month with this next law regarding the forgiveness application. Hopefully everything is moving to make it simpler for small business. So that's a positive. But you can start gathering your payroll records and things like that and start to work through some of the frequently asked questions that are on SBA.gov. There's also a big part of this next tax law this law that might go in is whether or not they're going to reopen PPP funding. There was money that wasn't actually distributed under the last law. And so they have money they could reallocate, as well as they can assign more money to help out more businesses. And the idea of businesses being able to have a second round of access to this money. So that's what's coming on for the PPP money. I think they could talk. I was actually telling Julie before the show, you should probably get bankers, accountants, and payroll companies together. You could do an entire show on PPP just with those professionals. Again, maybe after this next law comes through and everybody can work through this fall, getting all of their items completed. Everybody knows what's happening for year end, and can move on to the next year. So I think there was also some recent tax relief from the state that actually Matt's going to talk about for me. I just wanted to focus on some of the federal items. So that's everything for now, and until I get your questions. Thanks, Steve.
Thank you, Heather Cozby. She's the CPA in Plymouth. We're now going to go to our State of the State report from Plymouth Representative Matthew Muratore. Matt, thank you for covering at the start. Our state courts are working as best they can, but sometimes they're delayed, so thank you.
Yeah, hey, thanks for showing up today. We appreciate it. I want to work. I love this set of panelists we have, Steve, because and I love them all every week, but this seems to make my job so much easier. I think everyone has covered pretty much everything I was going to cover, so I'm just going to highlight something very quickly. Chairman Potvin brought up about the two states that I think it was Alabama and South Dakota that are running confirmed cases of about 16%. The last time Massachusetts was at that point was on May 17th. So it gives you an idea of how far we've actually come. And it's actually been it's actually been 6 months now since the governor declared a state of emergency here. And I think what people forget is that we are still under a state of emergency here in Massachusetts. So a lot of the things that have been done over the last 6 months and will continue to be done are under that state of emergency. So where we stand after 6 months, it's interesting. Dr. Potvin went through the numbers, so I won't go through the numbers. But when you look at the total confirmed cases in Massachusetts, again, we are running 0.09%, which is great. If you look at the total population in Massachusetts, 6.9 million people, the total cases of 123,000 plus is a 0.017% have been confirmed with COVID-19. The total deaths continue to unfortunately rise, but at a slower pace. The 3-day average is 2%. Hospitalization is at 2%, with 310 people in the hospital as of yesterday throughout the Commonwealth. And then the total amount of individuals who have been tested in the Commonwealth since the beginning of this is it's approaching 2 million. It's at 1,980,000 people that have been tested so far, and these are individuals that have been tested in the Commonwealth. So we are doing a great job with testing and continue doing a good job with tracing. which brings me to the whole mask, wearing the mask and the gatherings. And Chairman Potvin brought it up eloquently, talking about the gatherings that really is causing the issue now. And in particularly, we're seeing a lot more younger people. When we first started this show back in March, April, and May, we were talking about people in their 60s, 70s, and 80s and 90s that were being confirmed and getting cases. And it was very few people under the age of 50 that were getting it. Now we're seeing the opposite happening. And I think we've all done a good job of educating people of wearing masks, and particularly if you have underlying conditions, because 98.2% of all deaths have come in Massachusetts with folks with underlying health conditions. So I think we've done a good job of getting that, but I think our younger people are thinking it's okay to go out and still gather without wearing masks. And it's simply, if you want to gather, social distance and wear masks. But we are seeing a serious uptick in the people in teenagers, ages 20s and 30s and some 40s as well. So it is important to control that until we have the vaccine in place. PID Plymouth, they seem to be getting more cases at the hospital. Now up to yesterday, they're at 23, which is more than double or close to double from last week when we were on. And they have one person in the ICU with a confirmed COVID case. I know Michael talked about the census, and it is so important. It's unfortunate the census date was moved up, but we have to get people to sign up for the census. I'm not sure what our numbers here are in Plymouth. I think the last I saw was somewhere around 70%, but we need to get everyone to get on the census. It involves funding for programs, and if we don't have the fundings for programs, or they're not enough funding because we didn't get the census done, we're going to have a problem over the next decade. So it's important that people go to 2020census.gov to do that. With regard to the state budget, we are still waiting, as Heather brought up and Michael brought up. There are conversations still going on at the White House and the House and the Senate, trying to work out some sort of deal. We are on hold here with the state budget. We're doing monthly budgets for the state, but we're still waiting for the federal relief to see what we're going to be receiving from the federal government in order to get the state budget done. We're hoping we're going to try to get it done by the end of October, but it's going to depend on the federal government. I keep getting asked about what states are now able to travel into Massachusetts. So quickly, I just wanted to read those. It's the state of Washington and Oregon, Wyoming, Colorado, all the New England states, New York, New Jersey, West Virginia, Pennsylvania, and Delaware are all able to travel into Massachusetts without any restrictions. And that is my update for today, Steve.
More time and have them give us their closing thoughts. We're going to start with my brother, Dr. Philip Triffletti. Phil, what's your takeaway today?
Well, first thing is we're all susceptible, really, and there are things that make us more susceptible, things like diabetes, high blood pressure, obesity, age. So most of us in the community are susceptible to complications with COVID-19. So we have to keep that in mind as we continue to have all this safe health practices. Dr. Fauci said, follow the science, which I think is very important. We really want to, offer to people things that are scientifically proven, whether it's treatments, vaccines, et cetera. So continue to listen, I think, to your health experts on the national, federal, and local level. Dr. Fauci also advised us to be humble, really, about what we do know and what we don't know. We continue to learn new things all the time. We may learn things coming up in the near future that contradict what we thought, but just have to be prepared for that and understand that it's an evolving process for us all. A reminder, get your flu shots now. It's the time of the year to do that. So if you haven't gotten that, make sure you do. And then the last thing I like to say is make every day count. Thanks, Steve.
Thank you. That's Dr. Philip Triffletti. He's an attending primary care physician at Beth Israel Deaconess. Now going to Dr. Barry Potvin. Barry, what else can you add?
Sorry, I had to unmute myself. I just was about to say something about flu shots, but Dr. Triffletti beat me to it. I would like to remind people, however, that there is a new mandate from the state that all children from 6 months of age up to college age must receive flu shots before the end of the year. It's vitally important, and I certainly hope that there'll be a really strong push to get everyone in congregate living facilities vaccinated against the flu also. The only other thing I can say is that we're not past 14 days. We've had about 30 new cases of COVID-19, and this happened after many weeks when we had virtually none. And as was already mentioned, this did involve a lot of younger people. So the bottom line here is really that we can't stop this virus. We can partially control it. To do so, we need a lot of cooperation. And eventually we'll have a safe and effective vaccine, which will obviously return our lives to more of a normal sort of situation. And people's lives, you heard me go through a lot of statistics about deaths. Lives, I think everybody agrees, are a lot more important than political leanings. So please cooperate, please wear masks, please do whatever you can in terms of avoiding large gatherings to prevent this virus from proliferating through the community. Thank you, Steve.
Thank you, Dr. Barry Potvin. Again, he is chair of the Plymouth Board of Health. Dr. Gary Maestas, you and I attended a meeting of the Rotary Club on Monday, at which time we heard the president of Beth Israel Deaconess here in Plymouth imploring us to follow the advice of Dr. Fauci. And we've just heard from two local doctors, and Dr. Phil reminded us to listen to Dr. Fauci and also to national and local health experts. But the question for you as the educator leader is, the question we received was, a parent does not agree with sending their child to the hybrid model and the parent threatens to cause a scene at the school. What would be your response as superintendent?
Well, I know there are some parents in Plymouth that have chosen to actually have their children taught at home, and that's what our accommodation is for those children. If a individual chooses to come to a school and we have school resources in our buildings, we would definitely exercise that responsibility within the school department to do that. So our schools handle anyone that comes to school that would create a disturbance. We would handle them the same way, whether it was for COVID or anything else. But we are following the guidelines that we have set by the CDC, the Massachusetts Department of Education. I think we have a good plan in place. Keep in mind, we do have a model for students to study at home, and that model is live and active. So, Steve, I'm just encouraged by what I saw today walking through buildings, and I think our parents would be pleased with what we have rolling out for our students, moving into this unknown territory of education in 2020.
Thank you, Dr. Gary Maestas, and certainly we're proud of all of our administrators, teachers, and the support staff at the Plymouth Public Schools on this first day of school. Michael Jackman, you are district director for our local congressman. What are your closing thoughts?
Yeah, just, excuse me, just want to amplify the message about the census. If you have any questions, call our office, go to that website that Rep. Muratore mentioned, 2020census.gov. If you're a phone person, you can also call the census at 844-330-2020. There's a bunch of ways you can respond and make sure that your voice is heard and that you're counted as part of the census. It's so important. One other thing I wanted to mention, we talked a little bit, Heather and I, about the economic impact payment, also known as the stimulus checks. There are still folks who have not received their stimulus payments from back in April and May. We're still working on behalf of those folks. The IRS has slowly but surely reopened a lot of its offices, and most significantly, the Taxpayer Advocate Service has been a liaison for us in terms of helping people locate their economic impact payment, why they didn't get it, why it's being held up, if it was mailed and inadvertently discarded, as happened with a lot of the debit cards that were issued. we are still able to help folks. So we're actually more able to help folks now than we were back in May and June. So again, if you're in that boat, feel free to give us a call, 508-746-9000. Thank you again.
Thank you, Michael Jackman. He is District Director, Congressman Bill Keating. We're now going back to Heather Cozby, Plymouth CPA. Heather, what's your takeaway?
Great. Thank you so much. First of all, it's so good to hear from everybody and kind of get back into this. And some people I hadn't seen professionally yet on this show is fantastic. My takeaway is the infamous quote, "Winter is coming." So cue dramatic music, small businesses in Plymouth, you're seasonal. You've been through hell already. Now you have next 6 months really to make decisions about what's going on. And I really want to encourage you to take a hard, long look at your business, figure out what you need to do the next 6 months, figure out how much revenue you think you're going to have, and get ready to make some hard decisions. It's better to get ahead of these decisions. One of the questions that I have that I would like to actually have addressed on the show by a panelist is, with these loans, if your business is not going to make it, so you've gotten a PPP loan, you've gotten an economic injury disaster loan, so you've determined it's just, your business might have been struggling before this happened and it's just not going to happen, and you have to make that decision. What's the next step? So for most businesses, it's bankruptcy, and these loans are not personally guaranteed. So there is some high level, difficult planning and decisions that might need to be made that some businesses might be wanting to look at. So as a business owner, you need to think about how much of your personal money you're going to dump into a business that just might not be recoverable, not for anything you did as an owner, but just because of the circumstances. So those are the types of things, I want people to unfortunately start to think about. And hopefully we can maybe have some discussions about that here in the future. But as always, thank you so much, Steve and PAC TV and everybody for having me. I appreciate it.
Thank you, Heather Cozby, Plymouth CPA. Matt Muratore, your closing thoughts. He is our state representative.
You went to by so quick. Sorry about that. I want to work off of what Heather just said too about businesses. Yesterday, the governor announced extending tax relief measures for small businesses. Earlier this year, there was some changes to small businesses, particularly restaurants and hospitality sectors that deferred payment of taxes. So the small businesses that had regular sales tax or meals tax or room occupancy taxes that were due between March 2020 and April of 2021 now, they have until May 21 to pay those. Also, businesses that collected less than $150,000 in regular sales plus meals tax in 12-month period ending February 29th of this year, they'll be eligible for relief for sales and meals taxes as well. And businesses that collected less than $150,000 in room tax in the 12-month period will be eligible for relief as well. And those that are not in that, but are small businesses, but have over that amount, there'll be some other relief. There'll be relief from you can late file without any penalties, because those will be waived. So, and I think on a state level, I think that's a little bit. Some more will be coming. As Heather said, winter is coming. So there, I know the city of Boston just extended outdoor dining till December 1st, although it's going to start getting cold soon. So we're out working in the state levels too to see what else we can do to help small businesses. So that's the takeaway today. I do want to publicly thank Dr. Potvin and the Board of Health for what they're doing in Plymouth and the tracking they're doing daily. This is the reason why we're back on again, is because the Board of Health has been tracking these numbers, and we saw a spike in numbers coming over the last 2 or 3 weeks. And, we said, let's get back to doing the show on a weekly basis. So to remind people that we are still in a state of emergency, and we still need to continue to be vigilant until there is a vaccine in place. And also, I know Dr. Maestas is actually going to be retiring at the end of next week, I believe it is. So I really want to publicly thank him on behalf of the people of Plymouth, for all the job you have done, the leadership you have provided, and what your legacy, I still believe, is the folks that you've left in charge. Chris Campbell being number one. So thank you for what you've done over the last, couple. We were just talking to my daughter last night. She just graduated from high school, she started when you, at first grade, when you started the superintendent. So she was reminiscing about that last night with us. So thank you for everything, and we wish you well, and we'll be in touch.
Thank you, and that's Matthew Muratore. He is the Plymouth State Representative. Thank you to all of our guests, Philip Triffletti, Dr. Philip Triffletti, Dr. Barry Potvin, Dr. Gary Maestas, Michael Jackman, Heather Cozby. And now we go back to the beginning to Ken Tavares. Yeah, Ken, I missed your opening statement, kind of like some of our viewers. They can check in and out, but I look forward to your closing statement.
Thank you, Steve. I also want to publicly thank Gary for the outstanding job that he has done and how he has led the school system in this community. We had the opportunity on Monday to speak, and I was able to tell him some things that were very meaningful to me and under his leadership and what he has done. So once again, Gary, thank you for all that you've done. Also, I want to thank the panelists. I think what comes across to me, the time and effort is the time and effort that they put in, but there is such a strong line of just plain common sense. And I think that as long as we follow that, we are going to be very successful in combating this flu. So much is ahead of us. I am not doubting for a moment that we're going to be challenged, and we're going to have to come up with some new ways to do things to get us through the next several months. But even though much is expected of us, I know that this community can do it. I've said it before, and I'm convinced. Last week, I had the opportunity during the closing statement to honor two women in our community. And I look towards the brightest spots and what people are doing, because I think it's a good temperature take of how Plymouth is combating the virus. But what I would like to do today is to thank a group of people, and that is the senior citizens of our community. The Board of Selectmen had the opportunity to issue a proclamation, as Rep. Muratore talked about. We were up at the Cal Center. You could see the smiles in our citizens' faces right through the mask. They were happy to be out. They were happy to see their building is functioning, and they were happy to see the staff. Michelle Brady and her staff have done an outstanding job. Barry de Blasio has been charged with making, in some ways, some very important decisions, and also to get us back as a functioning community. So thank you to all of those people. But my deepest thanks goes to the citizens, and I want to read from the proclamation that the Board of Selectmen gave to Michelle yesterday, and that is, whereas the Town of Plymouth and Select Board honors and respects its senior citizens for their strength, resiliency, and hope, the Town of Plymouth and the Select Board expresses its appreciation for and celebrates the senior citizens of Plymouth. They have been an outstanding example. They have been through so many tests before, but once again, our senior citizens have come forward and demonstrated to us and led the way. So thank you to them this week. We appreciate all that you have done. And thank you to everyone on this panel for another outstanding program. Thank you. Thank
Kenneth Tavares. He is chair of the Plymouth Select Board. Special thanks to Julie Thompson, Executive Director, Plymouth area PAC TV. We are grateful that she helped in the beginning with today's presentation. And again, to Dr. Maestas, Gary, as you know, I'm the father of one of your administrators, and this Saturday I'll be the father-in-law of one of your teachers. And I know you have their support, but I'll speak as a town official just to say that I greatly appreciate all of your support to Plymouth Town Meeting and to me as moderator, and best wishes for you upon your retirement. And in closing today, just like to say to everybody, we'll be back here next Wednesday at 12 noon, and please join us. I'm Steve Triffletti, Plymouth Town Moderator, and good day.